What is up, you guys? My name is Austin Marks and welcome back to my YouTube channel. So I'm currently a respiratory therapist. I've been a respiratory therapist for about 2 years now. So on my YouTube channel I talk about respiratory therapy, I talk about respiratory therapy school, I talk about how to do better in school overall. I also mention a few things about PA school or physician assistant school. I also talk a little bit about personal finance, so if you want to learn any more in any of those aspects, just make sure you check out my channel. So I am also the admin of a Facebook group called the RT Club. Now this is a place where respiratory therapists or RT students can come together and kind of collab and think about different things. They can ask different questions. Maybe they'd be about the board exam or a specific patient they have. Well, anyway, in today's video I'm going to be talking about what not to do as a new grad. So I'm guilty of many of these things, especially the first one. So one thing to not do as a new grad is to act like you know it all. So when I first became a respiratory therapist, I did ask tons of questions because there was a lot that I did not know. There's still a lot I don't know. However, if something was going on, I thought to myself, oh, I learned that in school, I know that. However, no. There are a lot of times when I thought I knew what I was talking about, but in reality I was totally off the charts. So once you get your first respiratory job, do not act like a know-it-all. Now this was asked on a Facebook group with many seasoned RTs, and that was the #1 answer, is they say that new grads come in right out of school and they act like they know it all. So this is not just for respiratory therapists, but any profession. So if you're a nurse and you come right out of nursing school and you act like, I learned all this in school, I know it, think again. The second thing that many new grads do that they need to not do is be too scared. So they're too afraid to ask questions, too afraid to reach out, they're too afraid to do any kind of procedure. Even though they may have extubated someone or helped intubate someone in school, when they get out in the real world, they're just like, I'm on my own, I don't want to get my feet wet. So they may be too scared to talk to some of their coworkers, talk to nurses, talk to doctors. You're rounding with a lot of these other clinicians, and you're all part of a team to get the patient better. So communication is key. So you need to make sure that you speak up, speak your mind, let everyone know what you're thinking, and take their considerations as well. This goes along with being shy. Make sure you talk to everyone. You want to know who your coworkers are. You want to know who your nurses, your doctors, your PAs. You want to know everyone, just so they know you as well. So I've been working at the same place for about 2 years now, and I think I know majority of the people. I mean, everyone's coming in and out and going all the time. However, they know me. They know that I'm competent in my skills. So therefore, if they need something, they can ask me. The third biggest thing is that RT students will say, it's not an RT thing. So there have been plenty of times where if I helped nurses do different things with patients that is not particular my aspect. However, I help out. So when you're a new grad and nurses say, hey, can you do this? Don't think, that's not my job, because that's not going to get you anywhere in the hospital. So the next thing, I hope you learn this throughout school, is to treat the patient, don't always treat the numbers. So what I mean by this is if you're in treating a patient and they're up talking to you and everything's fine and dandy, and then all of a sudden their stats say that they're reading 65%, and you start freaking out, you don't know what to do, but yet the patient is having a full conversation with you and they're not in any distress at all, and you start throwing an armor breather on and give them a few nebs, you're freaking out. But in reality, all that happened was their finger probe came off, and that's why it's not reading correctly. Or maybe the blood pressure cuff started inflating, and therefore that stops some of the blood flow from going to the finger. So make sure that you treat the patient, not the numbers. Yes, you need to take both into consideration. However, you need to look at the patient and what is actually happening with them. A lot of times you'll have artifact going on with different things as well. So what exactly is going on? Earlier I talked about myself not being very arrogant, but being confident in my skills. So when I first started at the trauma center that I work at, I was afraid to do traumas. I wasn't really too sure what to exactly do. I was kind of hesitant at first. I just wanted to watch others do it a few times before I officially jumped in. However, saying that, you need to make sure that you're not hesitant about any of your skills. Like I said earlier, you learned it in school, you know how to do it, so make sure you jump in. However, if you're like me and something is totally new to you, make sure you watch it a few times before you go ahead and jump into that and someone gets really hurt. Know your skills, know what you're capable of, but also know your limitations. Well, anyway, guys, if you have any questions, make sure you leave a comment. Make sure you check out that Facebook page. Make sure you follow me on Instagram. Anyway, see you in the next one.